Welcome to Proclaim FM. This is Rebecca from the Morning Mix, and this morning we have 4 guests to talk about the COVID-19 pandemic. All 4 guests are from the University of Toledo. 3 of them are from the Physician Assistant program on the medical campus of the university. Of these 3, I believe that 2 are practicing PAs in the emergency medicine department at UTMC Hospital, and 1 is a student in the program. Is this correct?
Yes, that's correct.
Okay, our 4th guest is no stranger to Proclaim FM, has been in the studio many times to talk about different health issues. He is a veteran professor of public health from main campus from the School of Population Health. Welcome, all of you, to Proclaim FM.
Thank you.
Yeah, thank you.
Thank you.
So let's start by introducing yourselves. Tell our listeners a little bit about your education and your professional credentials. Who'd like to begin?
Sure, I can go first. Hi, Rebecca. Thanks so much for your warm welcome, and thanks so much for having us on your program today to talk with your listeners. Hi, everybody. My name is April Gardner, and I've been a clinically practicing physician assistant for the past 19 years. I'm a graduate of the Medical College of Ohio in 2001. And since that time, I've been practicing in the area, and I've practiced medicine in family medicine, cardiothoracic surgery, urology, a little bit of geriatric medicine, and the emergency department. And the past 8 years, I have been practicing in both family medicine and the UTMC ER. And since March, most recently, I've also been working in the COVID ICU at UTMC. I've also been in PA education for the past 14 years, and I'm the program director at the University of Toledo Physician Assistant Program in the College of Medicine and Life Sciences on the very beautiful health science campus. I'm also working on my PhD in health education in the School of Population Health on the very beautiful main campus at the University of Toledo. And my dissertation chair is also happens to be a guest of the program today too, Dr. Timothy Jordan. And Rebecca, hey, while I'm giving some shout outs, I'd also like to, if you'll let me, give a giant shout out to some of the leaders at U Toledo. Our Dean of the College of Medicine, Dr. Christopher Cooper, the Chair of Family Medicine, Dr. Linda Spear, and then somebody near and dear to our hearts for many years, the former director of the UTMC ER, Dr. Christopher Brickman, who has been with the university for more than a couple of decades and has had so many dynamic roles. These 3 have been just a few of many, many leaders responsible for responding to the COVID situation at UTMC. And it's really due to their quick actions that we've had increased safety in our community, decreased spread of COVID, and not just for our community campuses, but for our entire community. So I just wanted to say thanks to all of them.
So welcome, and thank you for joining us, April. And who would like to go next?
I'll go next.
All right.
Hi, everyone. My name is Zach Murphy. I received my bachelor's in exercise science from the Ohio State University. I'm currently a 2nd-year PA student at the University of Toledo. I'm really excited to get back into clinical rotations later this month and graduate in December.
Wonderful. Thank you, Zach, for joining us as well. And next?
I'll go next. Hello, everyone. My name is Sara Martino. I am a current practicing PA at the University of Toledo Medical Center. I actually earned my bachelor's in exercise science, my master's in public health with a concentration in health education and promotion, and a master's in biological studies with a concentration in physician assistant studies right here from the University of Toledo. I've been practicing medicine for the last 13 years. I've kind of gone around and did a couple different places I've worked and picked up, but mostly I focus on emergency medicine, internal medicine with a focus in geriatrics, and recently, as April said, the ICU. I'm currently the lead emergency room PA, and I'm also the lead COVID ICU PA.
Wonderful. Nice to meet you, Sara, and thanks for joining us today. And last but not least, introduce yourself, sir.
Hi, everyone. I'm Tim Jordan. This is my 20th year at the University of Toledo for about the first 16 years of my reign there, or tenure, whatever you want to call it. I was the program director of the undergraduate public health program. And again, I'd like to give a shout out to my boss, Dr. Joseph Dake. Our students in the Master Public Health program and the undergraduate program have been involved in contact tracing phone calls. Our health department has been kind of overwhelmed with that task, so we have been training students to make those calls. So that's been a really good learning experience. Prior to coming to UT, I worked for Mercy Health System. I was the Associate Director of Medical Education. That's just a fancy word for kind of the principal of graduate medical education for family medicine and internal medicine residents. I'm married, I have a beautiful wife, Pam, very talented insurance agent in Sylvania, Ohio. We have 2 kids, both are in medicine. They're practicing nurse practitioner, one in vascular medicine, one in family medicine and ER in Nashville, Vanderbilt. And we have 3 grandkids. Let's see, 2 grand dogs and 2 grand cats. So
Wonderful.
that's me.
Big old happy family.
Yeah.
Well, thank you so much for being here, all of you. Once again, welcome to Proclaim FM and the Morning Mix. Today, we're going to be discussing a very fascinating and potentially controversial topic related to COVID-19. I just want to say this. I'm here to ask questions and bring up some topics to professionals that may or may not reflect the beliefs here of myself or Proclaim FM. I want to put that out there. The topic that we will be discussing today: myths, rumors, wives' tales, and conspiracy theories. Wow, this could be pretty heavy, huh? But let's start with you, Sarah. Are you ready?
Sure.
Okay. You're a practicing PA, as you said, in the ER at UTMC Hospital, and you were also a recent COVID-19 patient, correct? Wow. Wow. As I recall, you were hospitalized for 12 days, including several days in the step-down ICU. What was that like for you and your family?
Well, it was very, very difficult for both myself and my family. One of the things that people don't realize is that COVID-19 is actually a very lonely disease process. What I mean by that is, you know, as a patient, when you have COVID-19, you're isolated. You're isolated from family, you're isolated from friends if you're at home. If you're in the hospital, you're basically isolated from everybody also. No one's allowed to come visit. Your nurses and physicians have to batch visits to your rooms. They want to decrease their exposure too. And also, you know, we have concern about the amount of PPE it takes to go, protective equipment that it goes to go in these rooms. So as a patient, you'll go hours without seeing anyone. You're just literally by yourself. It's very lonely. When people come in, they're in PPE from head to toe, which is a very strange experience for people who don't understand and don't know what that's like. And they're only in your room for a few minutes. Consults are done by phone. Sometimes they'll call your room and ask you questions so that they don't have to come in and be exposed. It's very lonely at your sickest. So, you know, you're confined, and then afterward, even when you're COVID-free, you still battle this stigma of people who don't want to be around you, you know, due to the fear of the unknown. My 2 older children did okay. They were able to understand why they couldn't visit me, but my youngest son is 6 and he had a really hard time. We tried to FaceTime every day, you know, just so that there was some type of interaction between us. But there were days that I just couldn't do it. I mean, I just couldn't even pick up the phone and call home. And he had a really hard time with that. They also had a hard time with people not wanting to be around them. My son had to go through a longer isolation, even for his baseball team. Even once we had been isolated for so long that I was even back at work, they still had him on isolation for his baseball team. So there's so much focus on the disease. A lot of people don't talk about that, you know, part of it. But as far as the actual disease itself, I can tell you, I have never experienced anything like that before. I'm young, I'm fairly healthy. I mean, I have some asthma, but, you know, other than that, there isn't a lot. I don't take any medications. You know, I run, things of that sort. The first couple of days when I had it, I didn't feel very good. I had a fever, shortness of breath, some real extreme fatigue, and then it progressed, and it got to a point where I wasn't able to get out of bed. I had to rely on the nurses to put me on a bedpan. I couldn't walk without the assistance of a walker and a nurse. I felt like my entire body was going to shut down, and there was nothing that myself or the physicians could even do to stop it. I mean, I literally had to answer in one-word sentences for days. I just couldn't get any more breath to get it out than that. I couldn't feel like I could expand my lungs at all. So the first couple of days were really frustrating. Like, my labs weren't really showing a whole lot was going on. My chest x-ray, CT didn't really show anything, but I couldn't talk. I couldn't breathe. I couldn't do things. And then finally my COVID test came back positive, and, you know, we kind of had assumed, but until that's back, you just don't know. I was lucky. I'm going to tell you that, because being a provider and being on this side of it, at least I knew who was taking care of me. I knew what they knew. I knew the limitations of what we can do right now and what we know and where we're at. But I have to tell you, I was scared. I was scared of the unknown, because we just don't have enough information yet. My fever spiked often, 103.5. I would break it for a couple of hours, and then it would be right back. My bed sheets were soaked, my poor nurses who had to take care of me. But there was a point where I just literally laid in bed and I watched the clock, because I just wanted to say, okay, I made it through another day. I made it through another day. I made it through another day. I just wanted to get through day 7 to 10, which is where usually people decline the most. And I counted each day as a blessing and just kept trying to count through those days. I'm going to be honest, I felt at one point when I hit rock bottom that I actually was jealous of the people who were intubated and on the ventilator, because they just didn't have to experience the havoc that COVID-19 was doing on my body. I mean, it was just so draining emotionally, physically, and mentally by day 7. So day 7 was my worst day. My oxygen requirements went up. I had to be moved to step down ICU and put on a mask breather for a while to even get me feeling better. After that, thankfully, with a combination of like some medication and just renewed faith, I started to slowly get better. My fever finally broke for good around day 8 or 9. Like, it just started to slowly improve. But I embarrassingly, you know, at a young age, literally had to sit on a shower chair while a physical therapist and occupational therapist washed my hair and body, because I didn't even have enough energy to do it. I mean, I can't even tell you how defeating that feels. I left the hospital on oxygen, a walker. I required home nursing and physical therapy. You know, it was nothing short of a battle. It's not over for me yet. I still can't go up the stairs without becoming incredibly short of breath. I still have some chest pain here and there. And I'm told that it'll be weeks before I even return to normal.
Wow, Sarah, so thankful that you are doing better and that you, we're going to say you beat this thing. You beat it. Yeah,
I hope we're past all that.
But after everything you've been through, Sarah, what would you say to our listeners about the COVID-19 pandemic?
Well, I mean, I know and realize people aren't able to grasp the disease themselves unless they've had it, they work near it, or you know, they have a family friend or someone that's had it. It's very scary, you know. I mean, we have very limited information on how to treat it right now. We know that the elderly and those with comorbidities are at great risk, but then someone like myself in my 30s, you know, ends up in the hospital too, requiring oxygen. We just need to really understand that the public health measures that have been taken to decrease the spread, or as we say, flatten the curve, you know, has helped, but it doesn't mean that the virus is eradicated. I mean, these things that we have done exactly what we wanted them to, and it has prevented the spread and it has helped decrease the amount of deaths in our state. But, you know, we're going to be looking at a second wave of infection, which may not come to the fall or winter. You know, we don't know when it's going to hit. COVID-19 is very real. The infection can range from mild to severe, and there's no way for us to predict at this point who's going to get what, or, you know, how bad they're going to have or what they're going to need. So, you know, our treatment options are varied at this point. As medical providers, you've got to understand that we struggle. I mean, we are very much struggling. We're watching patients that decompensate, and we don't have any way to improve their outcome. You know, it's all limited, and we're doing the very best we can. We are constantly studying and reading article after article to understand how to treat these patients, but data changes like almost daily on treatment plans for us.
Well, thank you for everything you do, though. We appreciate you and all the healthcare workers, medical providers at this time. I know a lot of people feel the same way, definitely. So thank you so much, Sara. Thank you. Dr. Jordan, I know we spoke last week. I think you said something like, not only are we suffering from a worldwide pandemic, but also from an infodemic. I've been thinking about that term, infodemic. What did you mean by that?
Well, it is an interesting term. Infodemic, I think, was used by maybe a Washington Post reporter maybe 20 years, 30 years ago. So the first thing I would say to your listeners is this is the first pandemic that we've experienced when we've had such easy access to the internet and social media influence. That has changed the game. People are getting their information from a lot of different sources, not just from their physician anymore. I think back in the way it was in 1918, you know, there was no internet. There was no social media. People relied on medical experts. Now, anybody can say anything, and people can tend to believe that. So having such access to that information can cause this infodemic. What's the word mean? It's a combination of two words. It's a blend of two words, information, obviously, and epidemic. So infodemic means the spread of both accurate and inaccurate information. Fact, rumors, myths, wives' tales or husband tales, you know, conspiracy theories, scientific research that all kind of blends together and creates this infodemic. It's a tidal wave of information. And so what happens is typically people kind of throw up their hands and go, I give up. That's it. I'm not going to watch the news anymore. I've had enough. I don't want to see any more of that. I hear that from some of my own relatives. You know, that's it. I'm just done. I'm just done. Others, hopefully, in this on this program, we rely on data, facts, and information and research to inform our decisions. So that's what we mean by infodemic, and all the experts would agree. This is a pandemic and an infodemic.
Okay, so answer this question then, Dr. Tim. With so much of this false information, how can we all practice good discernment in telling the difference between fact or false, false and true facts concerning the rumors and myths?
A great question. First, let me say that is not easy to do. It takes time. It takes effort on the part of the person that wants to find the truth. You can't just flip on the TV and turn to your favorite news channel, because you're not going to get a well-rounded, holistic view of what's going on. So it's going to take some work. You're going to have to read from a variety of sources, and they have to be credible sources. You can't get your information from YouTube, or you can't get your information from Facebook. Those are not credible sources. And so it does take some work. So I'm going to answer your question, Rebecca, I think, if I could, the same way I teach my students. Would that be okay?
Absolutely.
Well, in the classroom, I say there's 5 W's. The first W is who, W-H-O. Who's presenting this information? Who are they? What's their track record? Do they have any credibility? Do they have education and credentials in the field in which they're talking about? Do they have an ulterior motive? Are they trying to sell you something? You know, who is presenting the information, and what are their credentials? What's up their sleeve? Are they a snake oil salesman, or is it somebody like Anthony Fauci, who has a 40-year track record in credible science? The second W is what? What is it? What's being presented? Are they trying to sell you something? I think of the televangelist Jim Bakker. I'm not a fan, by the way. But he was recently trying to sell 4 ounces, which is about that much, 4 ounces of a little silver solution for $80. And that was supposed to wipe out the COVID-19 virus. And then he started selling silver infused toothpaste. So if you brushed your teeth with this toothpaste, you could knock out the virus in your mouth. I think that was like $55. Obviously, he's trying to sell something. And so what is the message? What are they trying to say? The third W is where? Where can you find this information? Is it only coming from one source? Doesn't that kind of tip you off? You know, if it's only on Facebook and nowhere else, I mean, that could kind of tip us off. If it's only on YouTube, you know, that should tip us off that it's a problem. And so where it's coming from is a big one. The fourth W is when. When was it published? As experts in my field will tell you, this virus changes every day. And information that we published last week or 2 weeks ago is already out of date. So if people are saying something that's 6 months old or 2 months old, it's already dated. So when was it? And the last W is why. Why are they putting forth this information? How are they trying to make you feel? You know, why? What's their motive? People deliberately spread misinformation to create an effect: outrage, suspicion, distrust, anger. You know, why is there, what's their motive? So in conclusion, I would say we need to be teaching not only our students, but our children, our grandchildren. Pam and I have 3 grandkids. Their education now is online. They hear the same things we do. And if we don't equip our youngsters with these tools to really determine what's valid and legitimate and what's not, and then we're just perpetuating these myths and rumors. So
Wonderful.
thanks for
Something
asking.
we learned in grade school: who, what, where, when, why.
Yeah.
I remember this.
The
We can apply it.
W's.
Yes, we can apply it now. Thank you so much, Dr. Tim. Let's take a step back a bit, talk about the big picture. Let's take an aerial view and describe for our listeners where we are currently with this pandemic. April, would you like to talk about that?
I am actually gonna
Oh, you are? Okay, Sarah, wonderful.
slide in and
Sarah,
take that question.
you go ahead and talk about that.
That's okay. So, you know, with all 50 states right now, what we're dealing with, including in Ohio, is some phase of reopening. Everything's slowly reopening, and what we're watching for in our, in our field, both the medical and public health field, is we're watching for spikes right now in infection rate and the development of what we call hotspots. So, in the CDC currently, they're talking about on May 30th, the overall rates of infection and hospitalizations are declining or remaining stable in a lot of the places, both here in Ohio and nationwide. We're seeing, we're still seeing the infections are just declining a little bit at this point at certain places. So as of, I think, June 8th, the CDC had reported that the total number of cases was almost 2 million here in our own country, with 110,000 deaths at this point. So the new cases nationally for June 8th alone was almost 18,000, with about 475 deaths just on June 8th itself. So, why there might be a slight decline in some places, other places aren't experiencing the same thing. So, locally, it's a little bit different. We have started to see a decline in the rate of possible tests, hospitalizations, and deaths, which is great for the hospital. We're happy to see this. But a lot of this is because of our community taking things seriously, and our initiatives from our governor, including the stay at home, the physical distancing, good hand washing techniques, and just wearing masks out in public to help prevent the spread at this point. But, we have to watch really carefully at this point what the reopening is going to do on these rates. And as more businesses open and activities restart, we're going to have to be careful. There is 7 other states right now who are ahead of us in reopening and are already reporting a large rise in cases as they're reopening. So we just, in our area in Ohio, need to stay vigilant. As of June 8th, here in the state of Ohio, we alone have had about 40,000 cases and 2,000 plus deaths, Lucas County is, a little higher than Wood County with over 2,000 cases. Wood County has had about 300 cases and Fulton County about 30 cases. But taking a step back from even just our own little area, because we focus so much on our own area and we don't look at the bigger picture, we have to think that globally, just all over, we have had over 7 million cases. 7 million cases and over 400,000 deaths, which is, a lot of people's friends, family, members. So Europe is starting to decline a little bit, but we're really seeing spikes in Africa and Central Asia. The World Health Organization, sadly, is recording its highest daily toll of new infections in June daily. They're getting the highest numbers of new infections. Brazil is currently being hit really hard right now. Their death toll just passed that of Italy's, which is, just heartbreaking. They are only ranked right now behind us, the United States, with the most amount of deaths, and the United Kingdom. India is also being hit really hard right now. You have to think that a lot of the areas that are being affected are where people are struggling with food and shelter, and they live in close quarters. They can't get away from each other. They can't self-isolate. So I think we're starting to see like a new spread into different areas, and it's just going to continue to pass from person to person, country to country, and it'll just kind of come right back around, just like it always does as people begin to travel and move. So, globally, we're not looking very good right now.
Okay, thank you.
Rebecca, could I add something there?
Sure, absolutely.
My concern is a lot of folks, including my own family, make the mistake. I think it's a common mistake for humankind is that we think of ourselves as a sample size of one. And we make this generalization like, well, it's not a problem here in my county. I don't see my ICUs filled up. And so it must not be a problem anywhere, right? We do that a lot. That's human nature. A sample size of one. We think our experience is true for everybody, and that's just not true. And so I would encourage all of our listeners, as Sara said, let's think globally, because there are no red states, there are no blue states, there are just COVID colored states. There are no red countries, blue countries, they're just COVID colored countries. And a disease anywhere today, because we are a worldwide economy, disease in any part of the world today will soon be a disease here. And so we have to have a global view on this and not consider a sample size of one. Thank you
for that, Dr. Tim. And Sara, you may have touched on this, and I know you did a little bit, but I'll ask this question as well. Since businesses and churches are reopening, I've even ventured out slightly, a little apprehensive in Northwest Ohio. Are we safe to assume that the worst is over and that we can go back to living our lives the way we did before the pandemic? I think I know the answer, but who would like to answer that?
I can answer that, Rebecca.
Thank you, Zach.
I know that's a really great question, but unfortunately the answer is no. I know that a lot of us are eager to get, our lives back to the way they were before the COVID-19 pandemic, but we still need to be aware that the virus is out there and that we need to follow the proper safety precautions to limit the transmission of the virus. So if we look at a lot of the past influenza pandemics since the 1700s, a lot of them haven't shown any seasonal variation. And they've seen a second peak 6 months after the initial outbreak. And given that this is such a new virus, we really don't know if there's any seasonal variation or if we're going to see more spikes as businesses open. So it's really important that we learn from these past influenza pandemics and, we follow the proper safety precautions set by medical and public health experts so we can limit this transmission of the virus.
Absolutely. Thank you so much, Zach. And so with everything reopening, how can our listeners reduce their risks of infection and protect themselves and their family members from getting sick? Who would like to address that?
I'll take that one. I'm going to start with some very basic biological science, and that is the SARS-CoV-2 virus is a virus. Mm-hmm. And viruses have done what they've always done. From the beginning of time, they're going to look for new human hosts. because without new human hosts and getting into that human body and replicating, they're going to what? They're going to die. And so viruses need this continual source of new human hosts. And so this virus is really good at finding new hosts. So one of the ways that you can reduce your risk of getting infected is pretty simple. Just don't make yourself available to the virus. Avoid being in those situations where you become a host. So how do you do that? Well, SARS-CoV-2 is a respiratory virus. As much as we like to talk about, washing our hands and washing surfaces, honestly, a very small percentage of cases are transmitted that way, of touching a surface and then rubbing our eyes. Very small percentage. Most of what we receive, the primary mode of infection, is by breathing it in. This is a respiratory virus that's in the air. So how can we avoid those respiratory viruses? Where do they come from? Well, they come from when we talk. Right now, when I'm talking, even though I can't see it, thankfully, in my room, but there are probably millions of particles from my mouth and nose. When we sneeze, when we laugh, when we shout, when we sing, all those things are suspended in the air, and we breathe those particles in. And so think about the recent protests over police brutality. You see thousands of people without masks. What are they doing? Shouting, screaming. Think of the police officers shouting at the protesters. I predict there's going to be a major infection spike because of the protests. We're already seeing it among National Guardsmen who are coming back and now testing positive. So if you don't want to get infected, don't put yourself in a situation where you're breathing those particles. If you have to be in the same room with people that you don't live with, then as we've said, distance is the key. 6 foot is a bare minimum, honestly. Those respiratory particles go way farther than 6 feet. I recommend 12 feet. Why not 24 feet? It's kind of weird having a conversation at 24 feet, but the farther is better. And indoor environments are the worst. Don't go to clubs, bars, restaurants, anything that's confined and you're breathing the same air as strangers who don't live with you, you're putting yourself at risk. Outdoor ventilation is much better. So churches, boy, I know my pastors called me about 5 times asking for advice on this. And I told them recently, I said, hey, open the doors to the left and right of the auditorium and let that fresh air come in. Because fresh air helps to dissipate those viral particles that everyone's emitting. He said, what about singing? I said, I wouldn't. Let people listen. Maybe the praise team on the stage can sing, but I don't think I'd have congregational singing, because why? When you're singing, what's happening? We're emitting many more of those viral particles. So it's tough for churches. I feel for our pastors, because churches are based on congregational gathering and hugging and support and handshaking, and yet now we're told not to do that. And does the pastor wear a mask when he preaches?
Right.
No.
Yeah.
I mean, that's not going to work. Does the praise team stand up there on the stage with mask on trying to sing? I mean, it's kind of ridiculous. They're not going to do that. So it's a real challenge for churches, and I give a lot of props to those pastors who've been creative, like Brandon Williams at the Hope Community has been very creative in doing things to reduce risk. So that's how you avoid it. Just don't share the same air with people that don't live with you.
And it is difficult. This is not something we all wanted or asked for, or it's easy to adjust to. So I understand the frustration. I do. I think we all feel it at different levels.
Yes.
Some of us more than others. So thank you so much for that clarification. That really helps. This question is for you, April. Let's talk about schools in the fall. My child wants to go back to school. What do you see happening in the fall? Will the University of Toledo be holding face-to-face classes? What about area schools? What are you hearing?
Sure, I'll be happy to talk about our local schools and universities a little bit and tell you about some of their plans. First, I think we need to understand both the universities and the school systems are really challenged as they try to solidify plans for the fall. As the situation with the virus evolves, so do school plans. So schools are really faced with having to make several types of plans right now for the fall, not really knowing which plan that they're ultimately going to get to use. Local schools and universities are preparing for 3 different types of learning scenarios. The first is that traditional, the one that we're used to, that face-to-face in-classroom learning. The second is online learning. And the third is a hybrid model of some in-classroom learning mixed with some online learning. And so there are some unique challenges when we think about that traditional face-to-face learning and bringing our kids back into the face-to-face style classroom learning and ask them to practice this physical distancing, not to touch things, not to touch each other, right? To wear a mask. And, you know, we're struggling with some of those things ourselves as adults. So, right? So imagine, right? So imagine, you know, trying to ask a 7-year-old to do that for all day long and on a school bus, you know, and, you know, to school and home from school. And even getting kids to school, physical distancing, right? A struggle. So, you know, those of you with 7-year-olds, and even 10-year-olds, you probably understand what I'm talking about, trying to get a kid to go to school all day and try to manage the things that we're trying to perfect for our own selves. So about online learning, well, you parents that have already been doing that since March, you're already experts at online learning at home, and you already identified the issues better than I can of what that's like, you know, trying to make your kids learn at home, you know, Wi-Fi issues at home, and miss days of work for yourselves, you know, all struggles with the online model. The hybrid model, where you're part-time in the classroom and part-time online, that has some difficult challenges as well. There are different ways to do this hybrid model, couple different ways that it could work. A couple of examples of this would be, some schools may ask half of the class to go to school in the morning and the other half of the classroom to go in the afternoon. And, you know, you stay on that kind of a track. Another school model could be where half of the class goes every other day, and then the other half of the class goes on opposite every other days. And this is going to create some real social challenges for our students who may not be paired with their best friend in the classroom now. And you know, the kids kind of miss school. Like you just said, your child wants to go back to school. They miss school. Most of them really like to be there. And so there's those social challenges. It's going to definitely be a challenge for our school systems when we think about transportation to and from school, how we're going to get buses, you know, with half the class there and half, you know, class back to home, and switching that out. And there's going to be challenges for parents who have to try to manage a hybrid school model with work, because work doesn't go like a hybrid school model. And then poor teachers. I can't even imagine, as a first and third grade teacher formerly in my career, I can't even imagine trying to create those kinds of lesson plans. But there is some good news. There is. On May 14th, the Ohio State Board of Education released a draft of a document they're developing that's designed to help school systems plan for these unique challenges and reopening in the fall. Toledo Public Schools did just recently announce they hope to fully return to face-to-face, that traditional style classroom in the fall. They're also preparing a plan for total online education and a hybrid model, just in case they need those other 2 scenarios. You asked about the universities. Both the University of Toledo and Bowling Green State University recently announced that they're going to resume face-to-face on-campus classes in August. As a program director in the College of Medicine and Life Sciences, I'll tell you, I am so excited about that plan. We really miss having our students in the classroom, and being on campus. Our buildings are pretty quiet and pretty lonely without them. But, you know, they're going to have to make some adjustments too. You know, like the school systems, the universities are going to have to prepare their students. College students aren't used to a campus environment where they have to wear masks and physically distance, and we're going to have to help our students to manage that. One of the things that we're going to do, a lot of universities have already announced this. We're going to start at the University of Toledo, start our semester a little bit earlier in August than we normally do. We're going to bump that up to August, pretty early in August. My students are going to return on August 17th instead of August 24th. So we have to make some adaptations. Another popular thing that we're hearing from a lot of universities is they won't have classes after the Thanksgiving holiday. And what that's going to do, if we start earlier in the semester and we don't return after Thanksgiving, we're going to reduce travel with faculty, staff, students, and reducing traveling reduces the risk of transmitting the virus to each other. And so that's just a couple of the adaptations that we're going to look at. As well, the universities are going to have to follow, just like the schools, and also develop that plan B and plan C with going back to online learning or a hybrid of in-class and online learning. So just remember that, the virus is still evolving and our plans are still evolving. And so if you've got kids in school or you're a university, a student, just know that we're anticipating further guidance from the state as the summer goes on. They're going to give us more direction on how to plan for that fall semester. If you're a parent, just check your kids' school website frequently for updates. And if you're a university student or a parent of a university student, check your university's website and keep in close contact with your specific program.
Wonderful. Practice patience, I think, is a good word as well. Because I wouldn't want to be in the shoes of those decision makers right now. And I know a lot of people just want answers. What are we going to do? What are we going to do? But yes, be patient as they're trying to figure it out and do what's best for our children and for college students and teachers as well. So thank you for that, April. Appreciate that very much. All right.
Rebecca, I just have a comment I want to make about our students. Our students graduated this spring, many of them in May, but what did they graduate to? So for instance, one of my best friends, his daughter is a theater major, Kent State, graduated. What did she graduate to? They're nothing.
Right.
And our students weren't able to have a ceremony. They weren't able to have a celebration. The typical gathering of thousands where people applaud and high five them. They missed all that. So my heart goes out to all of our students who graduated this spring because of what they missed. Many of them are uncertain about jobs. They're uncertain about graduate school. Should I go to graduate school? Should I take a year off? I also think about our high school athletes. As a former pitcher, first baseman, center fielder at Rossford, and I know April's daughter played at Springfield, I think about how many high school athletes completely missed their senior year. That would have killed me. And I know for my kids, both my kids who played sports, especially my son, who was a big-time baseball player, that would have killed Joe. So think about all the grief. I mean, grief doesn't have to be just death. Grief is from loss of a senior athletic season or a senior theater season. Think of all the musicals that we're not able to put on. So I just want to give a shout out to any of our students that might be listening. We're with you. We feel, we empathize with you, and we want to support you. So thanks.
And a lot of the school systems have done a remarkable job of making their students feel special during this time as well. So yeah, thanks to them as well. Okay, so we're going to transition into our topic for today, which I love: myths, wives' tales, and conspiracy theories. Sounds so controversial. And once again, I just want to let our listeners know I'm asking these questions to professionals on the subject. And these questions may or may not reflect, or the answers, my personal views, my political views, or beliefs, or that of Proclaim FM. I just want to put that out there. Okay, so here we go. Are we ready? Okay, addressing the topic. There are certainly a lot of those out there, those wives' tales, myths, and conspiracy theories, especially on social media. I love Facebook, and I'm seeing it everywhere. One that I've seen is this during this pandemic is that this pandemic, I should say, is being caused by 5G networks or gamma rays. True or false? What is this about?
This is definitely a popular myth that's been making its way through the internet and social media, Rebecca, but it's false, and here's why.
Okay.
A lot of the concerns about 5G are because 5G can operate at higher frequencies. Some are concerned like these higher frequencies can directly transmit the virus, or that the higher frequencies might decrease the immune system, making us more susceptible to the virus. But there's a few important points to understand with the transmission of COVID-19. As Dr. Jordan already discussed, it's transmitted person to person by respiratory droplets or aerosols from the mouth or nose of a COVID positive patient, not through electromagnetic waves. Also, 5G is only available in 378 cities across 34 countries, while COVID has affected over 170 countries. So we would expect that the countries that just have 5G would be the ones that would be affected by COVID-19. So regarding gamma rays, we actually had somebody ask us this comment on Facebook. The post read, "The government won't tell you this, but the pandemic is being caused by the human's reaction to electromagnetic radiation being controlled by the secret government. Isn't that right?" So our answer was, anytime someone starts their argument with the government or the authorities or doctors will not tell you this, that their evidence is erroneous at best. So this conspiracy theory is, pretty lame, and it's laughable at best. Mm-hmm. So let me kind of explain a little bit. So electromagnetic energy is a term used to describe all different kinds of energy released into space by stars such as, like our sun emits electromagnetic energy. Other sources of the energies include radio waves, radar waves, X-rays, ultraviolet rays, the gamma rays, the microwaves. So, and a lot of these energies have been around for a long time, and I would find it pretty hard to believe that a secret group of people have found a way to, harness all these energies and get them together and infect people all on January of 2020. It kind of sounds something like you'd hear in like a sci-fi film, but not even that believable. So there are current guidelines set by professional organizations such as the International Commission on Non-Ionizing Radiation and the Federal Communications Commission here in the United States to make sure the amount of electromagnetic radiation from devices such as like phones isn't at such a high level to cause harm to people. So like Dr. Jordan had discussed, the most important thing people can do is to, maintain that 6-foot distance at least between you and someone else that you're not living with. Make sure you wash your hands, avoid touching your face, and, staying home if you do not feel well.
Thank you, Zach. I think I've touched my face twice in this video so far. It's just a habit. Trying really hard. Okay, I have a big question here, so bear with me. Hopefully you can catch it all. We've certainly heard a lot about China in the news and on social media. Even our own president has said a lot about China's alleged role in the pandemic. I have heard that the COVID-19 virus was created in a secret laboratory in China as a biological weapon and was intentionally or unintentionally released. And recently, President Trump decided to defund the World Health Organization because in his letter to them, he said that the World Health Organization is trying to protect China and consistently ignored credible reports of the virus spreading in Wuhan in early December of 2019, or even earlier. including reports from the Lancet Medical Journal. Is this true or false? Who would like to address this?
I'll take this one. This is
Okay,
a
have at it.
really good one, and it is very popular. We hear a lot about China in the news. We hear a lot about China from our own politicians. So let's first take a step back and look at kind of our response to China. The American response to China has been kind of strange. I mean, we can't figure out whether we love China or whether we hate China. First, we love China and we compliment them and we say they're doing a great job. And then the next week we hate China. So from their perspective, they have to look at us and go, you guys schizophrenic or what? What, how do we react to you? Because there's this love-hate relationship with China. Second, regarding it being invented in the lab, my favorite expert's Mike Osterholm. Mike, if you're listening, I'll say hello. Hopefully this will get back to you. But Mike has said one time, I remember he said, there's no way humans could have invented such a perfect virus. And he didn't mean this in terms of, the negativity that came with it, but the features of the virus and its ability to seek out host is unique. There's no way humans could have invented it. Third, there's a guy from Ohio State named Dr. Shan Lu Liu. He's a Chinese guy at Ohio State from China. And he's an expert in genetic engineering, and he and his research team have studied this, Becky, and there is no evidence at all of those fingerprints or handprints that we would see on a virus if humans modified it some way. They're just not there. So bottom line, I mean, almost all experts today agree it came from bats in Wuhan region of China. Bats then infected an intermediate animal. We don't know what that animal was. Maybe it was a duck, but we're not sure. We're still finding that out. And then it made the jump to humans. All experts agree there is no proof and no evidence that it came from a lab. Now, this World Health Organization thing, oh my goodness. First of all, from a public health perspective and from a medical perspective, let me say I'm saddened by what's happened. Of all times when we need worldwide collaboration, we need partnerships, we need to cooperate with one another across nations. The United States finds itself blaming people and divorcing people. And I don't quite understand that. I don't agree with it. I know some of your listeners probably do, and that's okay. But from a public health perspective, what we're doing is we're isolating ourselves more and more from the rest of the world. And they're looking at us and going, hey, wait a minute, didn't you guys help start the World Health Organization in 1948? Weren't you a leading nation that helped put this together? Why are you backing out? So I don't quite understand that position. I could go into a lot of details. Let me just say our president wrote a letter to the executive director of World Health Organization. In it, as you said, he made some very serious charges. That letter was very quickly debunked. The Lancet, which is one of the most prestigious medical journals in the world, did something in my lifetime I've never seen. They came out publicly and rebuked our own president. And they said, you know what, you really need to be honest and not tell lies. It was so easy. All I had to do is go through the table of contents in the Lancet and see when the articles were published. I mean, that's really that easy to find out. So it didn't work because what was it? Just recently, I think it was May 29th, our president divorced, took the United States out of the World Health Organization. So that's where it is today. It's sad. It's going to hurt us. It's going to hurt the population of the world by not having this collaboration. We're not working together with other countries. As we think about the vaccine that's maybe being developed, what happens if China develops it first? What happens if France develops it first? What happens if Switzerland develops it first? Are they going to keep it for their own people? Will they share it with us? What if the United States develops it first? Will we withhold it from the rest of the world and keep it within our borders? And what about the ethics of distribution? So There's a lot of ethical concerns here, but that's where we're at. We are no longer part of the World Health Organization as of May 29th.
Oh, thank you so much. Thank you for clearing up a lot of that whole question there. I appreciate that. Another one that I've heard, and there I touched my face again. This is interesting. Okay, another one that I've heard in this pandemic, or that this pandemic was created by a deep state and the global elite to usher in socialism and take away our freedoms, and that mask wearing or getting a future vaccine also strips away our freedoms. I've heard this one a lot. Some people are even saying now that if and when a vaccine comes out, do not get it. They say that Bill Gates is going to include a geo tracker in the syringe that will be injected beneath your skin, and it will also include the mark of the beast. This is a lot. This is heavy. True or false? Who's answering this one?
I'll tackle that one, Rebecca.
All right, April.
Oh, wow, that is a lot to think about, Rebecca, just like you said.
Yeah.
There's absolutely no evidence of any global elite organization, that's announced that they're trying to, organize and take away our freedoms and create a different type of government like socialism. Governments around the world have really responded. They've had to use their best scientists to understand this very brand new virus. We've never seen this before. And in return, they've had to make some quick decisions and major changes on how to stop the spread of the virus. And I get it. I get it, right? Some of these changes, like staying at home all the time and canceling a big family Easter dinner, having to wear a mask every time we go outside, not seeing our grandchildren, physical distancing. All of those can feel pretty restrictive and imposing on our personal rights. But I'll tell you, if anything, just the things that we've already talked about today, if anything, I would tell you that many of our governments have not responded quickly enough with population health measures, and that has led to some of the huge outbreaks in areas that, like Sarah was talking about earlier, both locally, the state of Ohio and worldwide. And that's led to increased illness, increased spread of COVID, and the loss of life. As Dr. Jordan stated, right, viruses are naturally occurring, and they've really been around since the beginning of man. And some of these viruses, things we think about like the common cold, they make us a little inconveniently ill, right? They give us some sniffles and sneezes and other things like the flu, influenza, that comes around seasonally every winter. Those can make us really miserably ill, fever, chills, right? And the flu can even cause death. So COVID is an especially powerful virus, and it can cause very mild symptoms, right? The inconvenience, sniffly, sneezy, right, things. Some people are even asymptomatic. They didn't even know they had COVID. They may be potentially, they have it now and spreading it. And then it can also be, like Sarah was talking about before, her own situation where it's a system-wide inflammatory disease that can lead to rapid death. And so this isn't new. We've seen pandemics before. We've seen other viruses similar to COVID. We saw the 2009 H1N1 virus kind of sweep our country. We've seen the 1918 flu create a pandemic. And so deadly pandemics really aren't new to us. They just aren't very frequent. And like Dr. Jordan said, that we've never had a pandemic at the time that we've had social media, and that's really played a big role in some of the myths and conspiracies. You might be interested to know, Rebecca, that more people died in World War I due to the Spanish flu, that we call it Spanish flu, and trying to get away from some of those terms. We don't want to blame China. We don't want to blame Spain, right? But that's where it originated, so they get the blame. But you might be interested to know that 1918 influenza killed more people in World War I than the casualties of war did. And prior to World War II, prior to the era of vaccines, disease killed more people than war. So I think we need to really start unlinking this disease from politics and an election year around the corner, and start to look at it critically, at the disease itself, the disease process, and the toll on human lives that it's taking and creating in our country and around the world. Man's best defense, you said, hot button topics today, right? Man's best defense against disease is prevention. And the best prevention is a vaccine. And so it's really thanks to vaccines that we're protected from many illnesses that used to create death, used to cause death and permanent disability. Some of us who are a little bit younger in the audience and have never been exposed to these diseases, they've been protected by vaccines this whole time for most or all of their lives. And so they're not even aware that, of some of the tragedies that these diseases cause. Others of us are a little bit older and, we've been exposed to things like measles, mumps, rubella, chickenpox. I know I've had at least 2 of those in my lifetime, but we've eradicated some major killers like smallpox and polio, just simply through the use of worldwide vaccines. And these are definitely diseases, smallpox and polio, definitely diseases we do not want to bring back to the world. And there are currently laboratories all over our world, and even locally, like at UTMC, who are working on a vaccine for COVID-19. And we're getting pretty close to getting that. But, in the absence of having a vaccine, the best next step in prevention is frequently washing our hands in warm soapy water for 20 seconds, wearing a mask, and wearing that mask over our nose and chin. I keep seeing all over the place, right? I keep seeing people wearing their masks right here, right here, and that's not effective. Physical distancing and staying at home, right? These are all known ways to decrease the spread of the disease. The other thing too is, just frequently washing high touch surfaces. So even though these changes in our routines are, small measures and as a population, and they may feel a little bit inconvenient, I'm not really convinced that they're impacting our freedom. Oppositely, when we wear a mask and we wash our hands and we practice this physical distancing, we're showing our love to other people and our compassion to other people by just not spreading our germs and sharing our germs. Because remember, some of us are asymptomatic carriers. And so, we're showing selflessness by enduring these inconveniences at this time. This isn't forever. We just got to get past, this virus. We've either got to get our herd immunity in place or get a vaccine and get enough people protected and that we don't see this anymore. But ultimately together in this period of time, we're really showing love to each other, and saving lives when we practice these measures. You asked about Bill Gates. He's also a hot button topic a lot, isn't he?
Yes, definitely.
Yeah, he takes a lot of hits. He is one of many very incredibly wealthy people who provide financial resources to fund the development of vaccines and other non-medical things too, through grants. He provides a lot of grants, and pharmaceutical companies, they compete for these funds for a chance so that their laboratory can be the one to develop a successful vaccine. But after a vaccine is developed, it's the pharmaceutical companies that will be the ones to oversee the production of the vaccine and the actual vaccine distribution. So funders like Bill Gates, they're going to have nothing to do with the actual production or distribution of it. And similarly, I think that we could probably also belay any fear of geo-trackers and the mark of the beast coming through a vaccine. We got to look for other resources for those things. Vaccines are clear liquids, and they are delivered to humans in clear syringes with very tiny, thin needles. And I think Sarah's going to agree with me. One of the first things patients ask us in the ER when we're about to give a shot is, how big is that needle? Because they're going to say, no, that needle's too big. And so we make these needles as tiny as possible to be as painless as possible so that our patients will allow us to give them needles. So there's no such thing as an invisible geo-tracker. So if a geo-tracker were present in our vaccine shot that we're getting, we would be able to see it in the syringe. The needles that we use for these vaccines are so skinny, right? There's no way a geo-tracker that we know of today could pass through such a skinny needle that we use for vaccine delivery at least. And there's really no evidence that this type of technology exists at all today. But if you have any doubts at all, just ask your healthcare provider before they give you your shot to just see the vial. We'll be happy to show it to you. Yeah.
That's good. That's perfect. Thank you so much. A couple things, April, that I loved that you said was, and I've heard you say it as well, Sarah, and maybe Dr. Tim and Zach as well, but the physical distancing. I appreciate that term. Social distancing has become kind of sword of the ears, acting like we cannot still be social. We're being social right now. And so thank you for that. Every time I heard it, it puts a smile on my face. And also, I loved that you talked about showing the love to others by following these social distancing, physical distancing practices, and wearing the masks, you know, being careful when we're out, loving on each other, not looking at it as our freedoms are being stolen. I tell you what, there's something about us as human beings that we just don't like being told what to do sometimes. I don't know if you would agree, but I can be that way sometimes as well. So thank you so much for that. Let's go on to another question.
Hey, Rebecca, before we go
sure.
on, can I ask a question?
Sure.
Zach is one of our trainees, and he's been making some contact tracing calls. And I think he ran into this recently, right, Zach? You called somebody, and an older guy said, you want to relay your story? I think it's a good story.
Yeah, I made a case tracing call for the Lucas County Health Department, and this gentleman said, he thought that I was working for some type of company that was trying to peddle this vaccine, and this vaccine had a tracker in it, and he, said, there's no way you're putting a tracker in me. And, so I wasn't able to get any information from him to be able to contact other people that may have been in contact with him. So he could have been continued walking around and transmitting the virus to other people.
And
there was just recently I think a major national survey, I think it was by ABC News, and they asked people if a vaccine was available, would you take it? And there was about 20%, as I recall. I just read it last night. But maybe 17 to 18, close to 20% said absolutely not. And so we have this anti-vaccine movement across the United States that's kind of driving a lot of these concepts about, stealing my freedoms or making me take a vaccine, those types of things. But I do agree with you that when we take the vaccine, we wear a mask, when we physical distance, we're really doing it not only for ourselves but for other people. So thanks, Zach. I wanted to share with the listeners your experience because it was fascinating.
Wow. And this is why we're having this discussion today, so that we can get, medical information on this, not the social media opinions. And, yes, some people are sharing some good things on social media, some links of some credible resources, but not all of it is that. So I am really appreciating this conversation today. Thank you. We're going to go on with another question, and here it is. This is one that surfaced on the far right YouTube channels and social media pages. They say that the death count for COVID-19 has been artificially inflated by public health departments, that doctors and nurses speaking to the media are paid actors, that dead bodies seen on TV and in the news are mannequins, and that COVID-19 is no different from the regular flu. They say that all of the mainstream media outlets are in this to cover up and continue to exaggerate and create panic. Is this true or false? And who would like to talk about it?
I am all over this one.
All right, Sarah.
This is absolutely false. And when you think about it, that of all the misinformation that's out there right now, this is one of the cruelest allegations even towards us. We've had, I think last count that I remember reading was about 270 deaths in Lucas County alone, and in the deaths worldwide. But these are real people. I mean, every time something says that this is false and fake and mannequins, like, you have to think that the people who are dying, of COVID-19, that these are real people. They have family, they have loved ones, they have friends. They can't even have proper funerals, at this point, I mean, these are actually people who are affected. It's thankful that a large population of our society is taking it seriously, and we are decreasing, the infection rate right now by wearing masks and doing physical distancing and hand washing. But it's hard. It's hard for us to hear things like that. It'd be very difficult to take an entire country full of medical personnel and get them in on this conspiracy theory. Most of us don't have a lot of extra free time. I can promise you that. And working together to pull off a hoax like this, organizing that would have distracted us from saving patients' lives, which is our number one thing that, we care about and that we want to do. So, we talked a little bit before about depending on where you live and what you see is going to also focus on, I think Dr. Jordan talked about what you believe, the N of one, I think you said it was. So, if you have not experienced, or if you have not known somebody who's had it or died from it, or you don't work in this field, it doesn't mean it's not occurring. It doesn't mean it's fake. It doesn't mean it's a conspiracy theory, and it definitely doesn't mean it's a hoax. I realize like people in maybe like Idaho who haven't been hit as hard as Detroit or New York City don't understand. It just doesn't mean that it's not relevant. I mean, it just means it's not relevant in their county, in their area. But I can never imagine as a medical provider, trying to induce panic. I mean, that, we are here to treat those who are ill. We are there to take care of those in their need. I mean, we would never want to cause panic for anybody. That is the opposite of kind of our oath of what we want to do. So, this is new. I understand that people don't get it until they finally have that actual interaction with it. But I can assure you, once you've seen it and you've lost patience to it, it can't be denied. Secondarily, one of the things I want people to understand is that COVID-19 is actually really detrimental to our medical industry right now. So what I mean by that is when people went on and we had the stay-at-home orders and we had the do not go to the ER unless you're critically ill, no elective procedures, this has actually resulted in a huge loss of revenue for hospitals. Our census is very low. And what's happened is it's turned around and resulted in people losing their jobs. I mean, because if the hospital's not bringing in stuff and the OR is not open for elective, what are you doing with that? What are those people who work the OR waiting room doing? And what are those people who work pre-op and post-op doing? I mean, you're dealing with layoffs. And I don't mean that even, bottom to top. I mean, we have medical providers who have been laid off because there is nothing for them to do. So, it's hurting us as a community too. We're struggling to take care of these patients. We're struggling with treatment plans. We're seeing a loss of census, people to take care of. I have coworkers who have been laid off. Some of us have been redeployed to other areas. We had multiple people, redeployed to COVID ICU because they weren't doing anything. They didn't have a job to do because of all the stay-at-home and standard orders. So, it's hard for me because I think anybody can turn anything into a conspiracy theory, and until you actually experience it, you see it, or you have someone, close to you die from it, it's just heartbreaking overall.
That's a real good point. In fact, I want to jump on that. About 14% of Americans know someone who died from COVID, only 14%. And so the problem is most of us live in these little silos. We don't know a diverse group of people. We know that COVID is attacking mostly minorities. So I would challenge your Caucasian listeners, how many of us have a lot of minority friends? Because we hang around other people that are like us, we don't see it. And your point's well taken. It takes some personal experience with it. I know 4 people that have died in Lucas County from COVID-19. One was the sister of a classmate from high school, Kent Miles. Another 2 people were African Americans, members of a church. So we have to diversify our friendships and get outside of our little bubbles or little silos and interact with people to really see this for what it is. And I appreciate you, Sarah, for bringing that up. That's an important
Thank you
topic.
again. Thank you again. I had a listener call not long ago. I hadn't heard from this person in a while, a frequent caller, and actually had came down with that and explained all of his symptoms as well. Just recently, a friend who is also is in the medical field as a nurse, young, probably similar to your age, Sarah, and similar story, all the same symptoms, everything like that. So when I'm seeing these things and hearing these things, it brings it more real to me as well. None of my family has been affected, none of my really close friends, but seeing these stories, I know it's real, and I know it's still here. So thank you for continuing to bring this education about the coronavirus pandemic to us. I do have one more question in regards to myths, wives' tales, and conspiracy theories. There's another biggie, okay? Um, uh, let's talk about a video that's on the internet currently called The Plandemic. Has it been taken down? I asked that too because I know you couldn't view it sometimes. It's very slickly produced, and it seems like a classic tale of whistleblowing. There is a woman named Dr. Judy Mikovits. Am I correct in saying her name?
Mikovits, yep.
Mikovits, in the video that claims that the pandemic was caused by big pharma, that Bill Gates and the World Health Organization are at fault, that wearing a mask will activate the virus in the body, and that Dr. Anthony Fauci should be charged with treason for his role in this cover-up. Is any of this true?
I'll take that one again.
Okay.
Another big one.
Yeah.
Wow. Another wow.
Yeah, wow.
This is really, really popular, and the major social media sites have taken it down because it's false, it's erroneous, but it is spread virally so much it's tough to get it down. It's still out there, and you can still watch it. Even my own daughter sent this to me about a month ago, and she said, "Hey, Dad, take a look at this. You know, this seems legit." Well, what makes it seem legit is, as you said, it's very slickly produced, and the way she talks in the video is very even tone, very businesslike, very official. She's got the white coat and the stethoscope. So you know what? Could I use the 5 W's, and could we evaluate it with my 5 W's real quick?
Yeah, your who, what, where, when,
Yeah.
how, or
Yeah.
no, something like that. I think I had
Yeah,
an
let's
there. Yeah.
let's do that. So
Go ahead.
let's go first. Who is Judy Mikovits?
Okay.
Well, she started out, had a pretty good career. She's one of 13 researchers. I think it was 2009. They published a paper in the very esteemed journal called Science. It's a peer-reviewed journal, hard to get in. I've not published in it yet. It's tough to get in. And they said that a mouse retrovirus was causing the chronic fatigue syndrome that so many people have, and there's no, as you know, no explanation, no cure for that. But she went on to say that using human fetal tissue and animal tissue, we're unleashing this devastating plague of chronic diseases on the U.S. population. So it was an earth-shattering paper when it came out in 2009. What no one wants to talk about, and this is the part of the who, what no one wants to talk about is 2 years after it came out, the journals started looking into the data sets, and they said, you know what, there's some poor quality control here, and even the laboratory where the specific experiments were done, they were found faulty, and so they retracted the paper. That's what we do in our field. You've heard this week about a couple papers being retracted because their editors, when they're doing their job, they go back and look at the data, and if the data is not clean, or they didn't do a good job, or if I'm trying to publish something, because I've never had one retracted, thank goodness, but Judy did. So that's the who. She's a discredited scientist, and we're going to talk more about it. So what's the what? The what is this documentary that seems to be a whistleblower tale. She uses this common debating technique where she gives like 500 reasons why, and she does it in rapid fire machine gun style, and it would take like 4 hours to just counter every single one of those arguments. So the what is, she's saying, yeah, I was fired because, and she's trying to make herself out to be a victim. By the way, she's been asked 7 times for interviews, and she's denied every single one. So I question why. Why would somebody be afraid to be interviewed? I think it's pretty obvious. What's the where? Can we find this anywhere else? Is it anywhere else in any scientific source, textbook, any other no, only on Facebook, only on social media. And this little known film producer named Mickey Willis is her producer, and Judy Mikovits, they're the holder of this information. It's only found in one source. When? Well, she hasn't published anything. I looked her up. She hasn't published anything in the peer-reviewed literature since 2012. If I did that at UT, I would be looked at as a professor that's not even worth my salt. I mean, I'm a full professor, but we still publish. My goodness, 8 years, I haven't done anything. So she hasn't published anything, but I did notice on Amazon, she has 2 best-selling books, believe it or not. Hey. She has 2 best-selling books, and guess what they're about? They're anti-vaccine in nature. And her co-author is this guy, I looked him up, his name is Kent Heckenlively. I would guess that's German maybe, Heckenlively. Heckenlively majored in English and political science in college. That's his background. And he's writing these books on vaccines with Judy Mikovits. Let's go to the last WY. Did you know that Judy Mikovits was fired from her job? She was fired from the University of Nevada in 2011 when the paper was discredited. Then she enlisted the help of a coworker to break into the lab and to steal some computer hard drives and papers and notebooks. And then she claimed that those were planted. She was framed, and she said a SWAT team broke into her house at night. And in the video, if you watch it, they have a video of a SWAT team breaking into a house, breaking the door down. That is not her house. That is not a SWAT team that had anything to do with Judy Mikovits. So what's the bottom line here? She's discredited. She's angry. She hasn't published anything since 2012. She was arrested in 2011. She was held in jail for 5 days. The charges, to her credit, were dropped. Judy, if you're watching, I'm sorry, but the charges were dropped. But she lost a case, a civil suit against her employer, who sued her for all the damages that she did, and she lost it. So a court of law said that she doesn't have anything to stand on. So where are we? No, it's false, Rebecca. Even though it's slickly produced, she looks to be very professional. She's selling a lot of books. What's her game? I think she's a snake oil salesman. I think she has a grudge. I think she has a grudge against the establishment, and she's trying to sell books.
Thank you for clearing that up, Dr. Tim. Appreciate it. We are running out of time, I think, but I want to do something fun before we close. Are you all about fun right now? Okay, I want you to speak to our listeners and give them some final words of wisdom. Wisdom can be very fun. However, each of you only have 30 seconds. Can you do that? Ready, set, go. Who's going first?
I'll go first.
All right.
I would just say, please be careful out there. The best way to avoid getting infected with this virus, with COVID-19, is not to share the same air with people you don't live with. And if you choose to go indoors, to the store, to a church, to your beauty salon, to a restaurant, please make sure that there's a lot of fresh air ventilation. Dr. Jordan talked about the doors of his church being open on both sides to allow for ventilation. Stay a minimum of 6 feet away from other people. 12 feet's better. Don't shake hands, don't hug, don't stay very long. The longer you're in a high risk situation, the more chance you have, the higher your risk is for infection. Frequently disinfect your high touch surfaces. Frequently wash your hands in warm soapy water for 20 seconds at a time. Stay home if you can, wear a mask if you go out, and remember that mask has to be over your nose to be effective.
There you go. Perfect. Zach, how about you? 30 seconds.
You touched on this earlier, Rebecca, but socially distanced doesn't mean socially isolated. We like that term, physical distancing. You can and you should still interact with your family and friends. You can safely interact with them outside. You can walk together, run together, ride your bikes, hike. You can go out on your back deck and, have dinner. But, if you're going to do those activities with somebody that you don't immediately live with, make sure you're maintaining at least that 6-foot distance and, make sure that you're outside where there's plenty of fresh air and ventilation.
Oh, wonderful. Thank you, Zach. And Sarah, 30 seconds. Words of wisdom.
All right. So I would tell your visitors that the virus is real. It's not fake. The pandemic is real. It's not fake. Hospitalizations and deaths are real. They're not fake. Not only have I seen these patients in the ER and in the ICU, but, just from myself. I mean, being there, I was 12 days of being in the hospital, being totally isolated from family, from friends, loved ones. Everything was the worst experience of my life, both physically, mentally, and emotionally. So it was terrible. And I hope that none of your listeners will get infected.
Thank you, Sarah. And finally, Tim Jordan, Dr. Tim.
I think my word of wisdom would be studies show that about 10% of the world's population have been infected so far. And if you look at the damage that's been done with just 10%, the economic damage, the deaths, the disease, the chronic lingering effects, that's only at 10%. And to get herd immunity, which means the virus doesn't go away, it just slows down, we need to hit 70% with this virus. 70. 70 minus 10 is 60. We have another 60% to go. I think we may reach herd immunity before we get a vaccine. That's happy talk, people that talk about something being available by the end of December. So if we're only at 10% and you look at the toil that it has created, the tribulations, the trials, what will we be at 70? So I would again say, please do your best to avoid being an open, willing, and ready host.
There you go. Thank you so much. And I just want to say thank you once again for each and every one of you joining today with your, you're giving us your professional wisdom on the subject of COVID-19. And I would think that you would agree that take the information that you've heard today, but like Dr. Tim had suggested, still fact check that the right way. If you want to look more into it, the five W's: who, when, what, where, and what was the other one? Why. I just want to make sure, I want to say how so bad. I think that's important. And I love that because it's so important for us to look deep. And sometimes it takes a lot of work, like you said in the beginning of this interview. But if you want real answers, search for them. They are there and find credible sources. And I look at you all as credible resources today, sources. And I thank you so much again for your time. Appreciate it. God bless you all.
Thanks for having us. Enjoyed it.
Thank you.